Good morning. Just looking around to see who I know in the audience. Okay, I've got you. Thank you for the introduction. My name is Maari Porter, and it's a great pleasure to be with you all today. As you said, I'm the Deputy Chief of Staff for Policy and Strategic Initiatives in Mayor Kenny's administration in the Mayor's office. I have probably one of the longest job titles in government. But what it actually means is I have the privilege of leading policy in the administration and really working with an amazing set of colleagues in city government and many city agencies and many partners. That's why I was just kind of clocking around the room who I work with on a set of strategic priorities to advance Mayor Kenny's priorities, such as pre-K, community schools, rebuilding our recreation and library centres. All three of those have been funded by the soda tax. Workforce development. Thank you, Ashley. I'm just going to take a side note for a minute for the work you've been doing on workforce development. Workforce development is one of the sectors which really is, that woman's holding that. There was one slide that I think was up there, and this woman's holding this seesaw, and its outputs down here and outcomes up there. I feel like I'm that lady in the middle, and the workforce system, you're just sliding down the outputs. So thank you very much for the work that you're doing on outcomes and really having a conversation with our workforce board here in Philadelphia to kind of pull us along. So those are some of the strategies. I also work on opioids, violence, traffic fatalities, and many, many others. But this morning I want to kind of talk to you from the perspective of having worked in government in 3 countries, the US, the UK, and New Zealand. Don't worry, I'm not going to go through all of those examples, but just know that I bring that with me and working for a time in philanthropy across 4 Philadelphia counties, Philadelphia, Bucks, Montgomery, and Chester. And no matter what side of the pond you're on or what political aisle you're from, there just are some universal challenges and truths in trying to get results out of these really complex systems. And as somebody in my office, says, and I think I'm going to try and do this today, is she always says to me, because I'm very policy and very wonky, she says, tell me the real, Maari. Let's do the real. So today, I'm going to really talk about some of the real challenges that we have in government. And again, I'm that lady like this, and I'll be truthful. We're tipping down on the outputs, but I am going to try and illuminate where government and philanthropy has worked together to achieve results at scale in Philadelphia. And as I said, I'm going to really kind of talk about why this is so hard. But I also want to raise a really nagging concern that I have, which probably exemplifies this lady who's kind of tipping, is that in government and philanthropy, we are awash with data that measures. We have so many metrics, we have so many outputs, we have so many outcomes. We know the difference now between outputs and outcomes. And we all have examples, and you're going to go through them this afternoon and this morning in greater detail, for example, on health. And I'm going to share some of our successes today. But here's what's kind of worrying me and makes me wonder, and I kind of really want your help with as we go into Q&A, is are we at risk of hitting the target but missing the point? Does the public and the people that we serve genuinely feel that the outcomes that we really tend to select to work on, does it really resonate and reflect their experience? And as we pore over our spreadsheets, how we debate, how we define, redefine, contribution, attribution, all of those things that I think people in here love to talk about, is it really reflective? And I say this because I do work in a political environment, and public policy operates in a political environment. So in Philadelphia, we just completed a mayor and city council primary, a little brutal, but we got through it in 4 more years. But the primary process, which from an immigrant's perspective, I absolutely love your primary processes. It's very exciting. It's a long tail. I know it gets very kind of exhausting, especially at the national level, but it really does amplify the voices, ambitions, and concerns of diverse communities. This is the time of year when government's really listening, local government's really listening, and residents are rightly demanding that we get better outcomes and we get them faster. They can't wait for our longitudinal studies. They can't wait for RCT trials, and this is the tension that we have in the system. And I'll just give one example, which was interesting to me, was, education was a topic that came up in the mayoral primary. It probably does in every election. But in Philadelphia, in many objective measures, our school district is improving. Our graduation rates are rising. They're not fast enough. I get that. Yet the recent polling by the Inquirer showed that people don't feel that our schools are getting better. When I read this, I was just absolutely shocked. All policy people, we're calling each other, how can this be? We are investing in pre-K, we're investing in community schools, we've gained local control of the schools, we're putting $1.2 billion in the schools. Dr. Haidt, the superintendent, has been working for nearly a decade on really trying to make some substantive changes, and they are being made. But then I had to kind of pause and reflect and really listen. And then I thought about our debates in workforce and the engagement we have with employers. Through the workforce strategy, I'm having conversations with employers saying, our graduation rates are rising. We're going to hit our target of 71%. I know it's not high enough, but it is rising. Please work with the school district. And the employers will say, well, okay, but that graduation rate really doesn't mean anything to me because kids aren't work ready. You're missing the point. When we talk to parents, I talk to my, people at my kids' public school, and I get very excited that not last year, but the year before, there was a 5% increase at the state PSSAs on fourth grade reading. A lot of us here applaud that, and we're really excited. So I try and tell people, bring your kids to the public school. I live in Fairmount. And yet people say, but there's mold and paint in my child's classroom, in the classroom. It's not safe. You're missing the point. And I will say in the primary process, if you really listened, it wasn't about academic achievement that was really resonating with people. And I get that. I think it's probably a baseline. People expect that from us. It was the conditions of the classrooms. And that's a testament to how terrible the schools and how disinvested we are. But we didn't, as policymakers, have a metric for lead and mold. We weren't really thinking it on top of what are those conditions, those things that people really, really care about. We kind of missed that point. So I guess that's what kind of keeps me up at night. So I just wanted to kind of put that out for you. So the nagging concern for me is that people like us in rooms like this, we are doing great work. And I want to, because we've got to tip the balance over here. But I just want us to think about, are we prioritising those things that matter most to residents and employers? And are we choosing measures that really resonate on the commercial corridor, at the corner store and on the block? Because it matters when you enact public policy. As I said, public policy is political. When we have to step outside of City Hall, as a mayor does, and live the real lives of people, we really need to also build the political will. So we need to have the right measures and the right communication. To invest in pre-K and to get a pretty brutal political process around the soda tax, which continues today and will continue as long as the soda tax is in place, you need to really be able to resonate with people. So that's what's nagging me at the moment. So I'm putting that out for you because you're all a lot smarter than I am. But my thanks to Nonprofit Finance Fund and the Federal Reserve for bringing your Investing in Results platform and networks of Philadelphia. Thank you very much. This is a really timely conversation for us. And in some of the context which Ashley really laid out around economic mobility, Philadelphia is no longer a city in decline. There are many people I work with in the city, including the mayor. All they've known is decline. All they have managed is decline. Now we have to change not only our metrics, our outputs, how we monitor, how we think about things. We're managing growth, and that's a really different mindset. So we're growing in population. Our job growth is, the fastest job growth we've had in the last 3 years has outpaced the national average. I mean, that's pretty astounding for Philadelphia. And our unemployment rate is low, although it's still above the national average. So despite these gains, we still have the stubbornly persistent high poverty rate of 25.7%, the highest among the largest 10 cities. So in government, in the second term, we are asking ourselves, and we ask all of you, and I know that you all work on this daily, but we really have to urge ourselves to think, if this poverty rate is not moving and it's not moving fast enough, it is government's role. We have a significant role, but you all have a significant role as well. And so as we're thinking about systems, we're really asking ourselves, and we're going to be looking, and we're already peeling the poverty data back for layers and layers and layers, because we have a lot of data, and we just don't use it well. What do we need to invest in to get people out of poverty and to get them out faster, quite frankly? How do we effectively raise incomes? Poverty is just a measure of income. It's not a measure of how many affordable housing units we have. It's an imperfect measure. It's not a measure of our social safety nets. It's actually a measure of income. So what can we do to really invest in people, kind of to Ashley's point, that raises up incomes? And then what are the changes in the funding streams that we need to get to results to communities? Please know that my urgency is not that we don't want to, and we are investing in long-term change. We're investing in pre-K. We're investing in the schools because we see the long term, the long run. let's also be frank, we also have a political timeline that we're on, and we really need to also invest in results that get us there quicker. So as you all know, investing in systems is really hard, but the payoff can be huge. And so I'm still on these challenges. I will lift us up in a minute. I feel like I'm like bringing us down, but I will kind of pick us up. But I just want to, again, from many different vantage points that I've had, there is some consistency in the challenges that we face. And we all lead lives with deep complexity, but in government, and who's worked in government? Hands up. Okay, great. In government, we manage in hierarchy and silos. This is not because we love a good silo, although some people do. We do it because in order to make sense, we're actually rational humans. We're bureaucrats, but we're rational. We organize in silos and hierarchies in order to make sense of delivering services at scale. And frankly, to accommodate some pretty inflexible funding streams. We also value bold ideas and leaders with big civic vision, but to make some of these really big changes that we need, we really often lack the courage and political will and shared societal values to actually invest in those bold changes. And again, I'm just going to come back to pre-K and the soda tax and the battle that has taken to really, we know the outcomes, but what it takes and the political will that is needed to be able to do that. And then there is this belief that, and in government and philanthropy, we put a lot of stock and pressure and expectation on nonprofits. And there is a belief among some that they should be run more like a private sector board, like by the private sector. But yet we in government and philanthropy, we don't invest like the private sector in nonprofits. We don't invest in the same level of research and development. We don't invest in wages at the right level. We don't invest in technology. We certainly don't invest in hangout spaces or snacks and all those table tennis. And we'll only pay, and the government will pay you about a 10% overhead rate, 15% if you're lucky. And I think, Ashley talked about the muscle to innovate and even the muscle to pay results. I don't know how you can innovate on a 10% overhead rate because we're just going to pay for your programmatic costs. We're not going to allow that. So again, I think, and this is, it's a conversation we have in government. It's one I constantly lose, but really trying to think about ways that we can not only invest in the programmatic outcome, but in the innovation. And that's really hard when you're in government, trying to justify to a budget director, yes, we want this output or outcome, but I need some money so that nonprofits and others can have the space to think. And that is where philanthropy does come in. And then I think philanthropy believes that nonprofits should partner with others to help develop outcomes. But again, I think philanthropy and government, again, we don't pay for nonprofits to actually participate in partnerships. And then I'll talk lastly, we talk with sincerity around targeting root causes, but we lack the consistency and courage to really explore and redress historical and structural inequities. And in our systems and the systems that I get to kind of experience, at their worst, criminal justice, public assistance, and some of our education, when operating at their worst, can strip people of their dignity, erode hope and pride. But here's the good part. There are these challenges and tensions in the system, and I do elevate it because I think that's how people experience our systems, and it's a source of personal frustration, but it is possible to get to outcomes. And sometimes it's the result of a really well-oiled, thoughtful plan, and I'm going to talk about one in addressing mass incarceration in Philadelphia, and in other times you just have to try something new. You're not sure if it will work, such as with the opioid epidemic, but the risk of not trying really is life or death. So let me just start with hierarchy and silos in the context of the opioid epidemic. So, as I said, I'm a bureaucrat, but hierarchy and silos are a permanent feature of governments. But when faced with the worst public health crisis for decades, opioid epidemic is worse than AIDS, the AIDS crisis, it can be overcome when you focus on a singular outcome, and in this case, reducing opioid deaths. Frustrated with trauma and the unrelenting upward trend of opioid deaths in 2017 and 2018. In 2017, we had just over 1,200 opioid deaths. That's 3 times our homicide rate. Mayor Jim Kenney in October last year signed an executive order, bureaucratic, activating 35 city offices for a joint emergency response to the opioid epidemic. We did this as we had to face the reality that our services were completely overwhelmed. For example, in Kensington, where a lot of the opioid deaths are concentrated, but not exclusively, we were, and still are, delivering trash pickup 3 times a week to deal with the debris and needles in Kensington. Now, if you're in Philadelphia and you've got trash pickup 3 times a week, that's pretty amazing. But it's not doing enough. It is not enough. We were dealing with encampments of homeless and addicted. We had Dr. Oz down. We had the New York Times, Under the Bridges, reporting, and rightly so, on encampments. We were responding to calls from school principals, calling us to help their students who are walking through syringes on the way to school. We were dispatching homeless outreach teams, medical-assisted treatment, and whilst constantly searching for new places and new beds. We had police who could not and did not want to arrest their way out of this crisis, but they needed solutions immediately on the ground. And that this onslaught is continuing, and we continue to have growing opioid deaths. And then we also had, most importantly, we had to face the truth with the community who felt neglected for decades. And at the highest levels of the administration, we had been meeting regularly. We pore over the data. We direct resources. At the agency level, we're trying our best to coordinate in every which way. But at some point, despite the best efforts, we needed a different approach. The epidemic was fast-moving, fentanyl rapidly rising. It still is. And our hierarchy and silos were just slowing us down. So we turned to our emergency management professionals for help. Professionals, officials who know nothing about homelessness, nothing about addiction, nothing about outcomes, nothing about prevention services, but they know how to get services to communities fast in need. And they know how to enact processes that can make life or death decisions. And they know how to hold individuals accountable. I think in government, that's the hardest thing to get, especially if you're trying to get to outcomes, is who do you hold within the system accountable? So we required, as part of this emergency management process, staff to meet and leadership every single morning. We've kind of got it down to two days a week now, but for about 6 months, people were meeting every single morning at our emergency response centre, and together they were engaged in a very intense process. And as a result, we've cleared and closed the major encampments. Dr. Oz has now come back. We've distributed 80,000 doses of naloxone citywide. We've reduced the number of unsheltered individuals. We're reducing overdoses. We're increasing our medical-assisted treatment options, especially in our prisons. 50% of people in, for example, that we surveyed in Kensington have gone through and will go through our prison system. So we're really doing a lot of work, and your husband is helping us very much, thank you, to really, that's actually a really good example I don't have time to get into, but what our prison system is doing to really treat people with medical-assisted treatment and to continue that treatment when they leave. And many other things, again, really trying to mobilise the community. And finally, just last week, the Philadelphia Department of Health reported the first glimmer of hope after many, many dark years, an 8% decline in the annual drug overdose deaths from 1,217 to 1,116. While it's too slow and it's no time for congratulation, it does provide us with a breath of hope to sustain as we try to work harder, and a moment to reflect on, and we haven't really done this work yet and we really need to, is how do we use this approach that removes silos and hierarchy. And it's also a time to consider how we may have hit the target, and our health commissioner did try and set us a target around this point. We're hitting the target, but I think it's obvious to you and to the community that we'll be missing the point. For them, it's not about the reducing the opioid deaths, that's one part of it, but it's really about economic revitalisation and improving their neighbourhood and their lives. So that's just kind of one example where we've tried to break down silos and hierarchies. The other example I want to touch on here is with philanthropy. And philanthropy, and there's many philanthropists in the room, so thank you for all the investments that you do in the non-profit sector and in working with government. And one of the most significant changes that we have seen by working in philanthropy recently has been in dismantling, maybe not dismantling, that's probably too bold a statement, but really trying to address one of our most damaging issues, and that's mass incarceration. So in 2015, Philadelphia had the highest incarceration rate per capita of the top 10 American cities. We were dealing with overcrowding and, frankly, just unsafe conditions in the House of Corrections, and we had a jail census of over 8,000. In 2015, when incoming Mayor Jim Kenney comes in, it's pretty much a foregone conclusion, and I was in the prior administration and plans have been drawn up, that any incoming administration would have to close the House of Corrections because of its state and open and build a new jail. No mayor in a progressive democratic town really wants to open a new jail, but that was, at least those of power, that was how people were thinking. But at the same time, Philadelphia had just won a MacArthur Foundation Safe and Justice Challenge grant with the goal of reducing the jail census by 33%. Highly ambitious, and frankly at the time I was hopeful, but I think myself and many along with others, we didn't really think it was possible. We've been working on trying to reduce our jail population, but it hadn't really been working. So to go to 33% reduction seemed, as I'll say, ambitious. But fast forward to today, we have closed the House of Corrections. We have not opened a new jail. In fact, we've reduced our jail population by 43% with the goal to reduce it by 50% by 2020. We will, and we feel confident that we will hit that target. Now, all the credit goes to the agencies and advocates who work on that, the courts, the judiciary, the DA, the defender, the city officials, and many others in our prison system. But a significant amount of respect goes to MacArthur Foundation for investing in government and investing in a big, messy, complicated system with political actors who don't always agree, including in the newspaper. And most funders are skittish about that. They don't want to give to government. I mean, they really are very wary of giving to government. And they don't want to be risky in the newspapers and associated with maybe some spats. But yet, when done well, the payback is significant. So we've had $7.5 million from the MacArthur Foundation, who has been a very sophisticated and patient and politically savvy funder. And so with the $7.5 million investment, they're going to get, we are hopefully going to get a 50% reduction in our jail population. And I think that is a really significant rate of return. And just a few things, I think what we learned from working with the MacArthur Foundation, they helped us set a really bold and clear singular goal that all the major institutional partners could align with. They set a table that these institutional actors could build trust, but I'll be clear that the circle was big enough, but it wasn't too big so that we couldn't actually move. And MacArthur helped us set direction amongst our partners who had different missions and motivations. You know, what motivates a district attorney it probably is a little different for what motivates some of our courts, but the overall outcome and mission aligns. We selected some early wins, which gave us some confidence and tools to press for more, and there was a relentless focus on data. But data and trust can be tested, and it has been tested, but it's the mission that holds everybody together. And I don't know if you saw in the paper last week, but just last week, the defender and DA really publicly came out against a risk assessment tool that the courts were considering. But because of the trust that was built at the table and the mission is aligned, I think our partnership is good. So, you know, we feel confident that we'll hit our 2020 target to reduce the population by 50%, and it will be significant. But to the community, and again, when the mayor goes out to the community and talks about this, you get, good for you. But I think not a significant time, and not a significant kind of, I don't know if applause is the right word, but I guess accolade that we would expect, because to the community, mass incarceration is just an injustice that has finally been righted. It's good, but it's not the point. The point is access to opportunity, and the point is dismantling deep structural racism. And so that real work begins for us now. We must look at the reinvestment of dollars back into the community. How that looks is we're still working it out. And we have to reduce racial disparities. Despite reducing our population, our jail population by 43%, our racial disparities are unchanged. So kind of really to close as we turn towards the next 4 years of the Kenney administration and we try and prioritize our actions and our results, I think you can see we are committed to outcomes, but it's, you know, in these systems, it does prove very hard at times. But some of the tools that we want to deploy at scale is really racial equity and behavioral science. And so I won't belabor it here, but these are the two tools that we've been exploring with. We've been using racial equity tools in some of our, I'd say, small programmatic areas, but now we're really going to be trying to do it across a broader range of economic mobility initiatives. And likewise with behavioral science, we've been using behavioral science, but we want to broaden the scope. So I'd say, you know, the good news is that the case for focusing on outcomes in government is one, but we might not always get there with precision, but I think we've won the hearts and minds. But we do have a long way to go as we now try to kind of transition the hearts and minds and some successes into how do we do contracts, how do we build incentives. So I want you all to take pleasure in hitting the target, because you will, but don't miss the point. The point is not a love of spreadsheets and measures and outcomes. It's the love of people, and that's why we're all here. So thank you. Thanks. Any questions? Hi.
That one. Okay. One of the narratives I've written in my head is that the reason that government pays 10% for overhead and doesn't pay for innovation is because there's not a realization, people, or if there is, they don't get it, or that there are not trusted inside voices saying, no, you have to do this. And so it's really refreshing and wonderful to hear somebody inside who gets it. What are the arguments you're getting from the budget directors who are saying, I'm not going to give you money, when they see the success of, for instance, an investment that gets to a 43% reduction in incarcerations, which saves money? It's just on the back end, if you will.
Yeah.
How?
I think it's because there is a focus on outputs. And so the budget director will want to know what, for the program, what is the cost per slot? And they'll really go through that in fine detail about what they want to achieve. And they do that across the board. They do that for city agencies, but they forget that our overhead rate is 44%. And so there's this kind of disconnect between nonprofits. And even though I said, some believe that nonprofits should be run by like a business, I do think that some people believe that nonprofits should run by the seat of their pants, should run on very thin margins. I think that it's kind of a dichotomy here, but that is what you get from the budget director. I will say, and if anybody's interested, I'll probably get fired for this, but out of LA, there's a project called True Cost, and where philanthropy and the nonprofit sector came together to government to make the case around paying the true costs and making that argument. And the issue we have in Philadelphia is we don't have, like in LA, they have an organization that represents all nonprofits. We don't have that in Greater Philadelphia. So nonprofits are coming one-to-one, and I'm getting the phone calls, and others are saying, you're killing me here, but they're onesie-twosies. And I think what we need is if the sector came together to government, you're much more powerful together, because the budget director can pick us all off. She's a good friend of mine, but she'll pick us up. Yeah.
Hi, my name is Linnea Cedarberg. Thanks for your discussion. You mentioned that you had seen how these systems work in other countries. Can you talk a little bit about different ways that people in the sector in the United States are currently partnering globally, or ways that we should do that more? Because I think there's a lot of other countries who we could look to as examples for some of the biggest problems we're trying to change.
Yeah, thanks for the question. So I will say the Pay for Success came out of the UK. And so their Treasury department really thought very hard around that. And why I'm struggling a little bit is the social safety net in the United Kingdom and then here is so vastly different, and how you finance social change is also different, and you don't have a deep philanthropic sector. So I think there are some real structural differences that you have. But as I said in my talk, the challenges that we have in systems are the same in the UK as they are in the US. And I'm not sure if the UK, I'm just trying to think if they've solved anything that we really haven't. And some of the issues aren't as bad here because there is a much deeper social safety net. Yeah, I can hear.
Thank you for your remark. No, but clearly with you, we're preaching to the choir. I'm very interested in what you would advise us to do for those who don't agree, who don't get it. what can we do differently? You talked about one thing, which was bringing our voices together, which I think is powerful, though scary, because you do have the check on the other side of our voices. But what are some other things that we could do that would help those who didn't come to church that day?
I think it's actually, I don't think people in government understand what it takes to actually run a nonprofit. And I think with people like the budget director who do understand obviously budgets and organisations and funding and streams, I think it would behoove us all and to maybe help educate. And I know that's hard to do, but to find ways so that the people in the public sector can really understand what it takes to run a nonprofit and what it really takes to get to some good outcomes. That is, I think that's what's needed. And how we do that is probably, a discussion, and translating it in a way. Municipal finance and nonprofit finance are very different. And so I think that maybe some of that nonprofit finance fund can maybe help us find some common language here, because I think it is people, they're speaking two different languages. Yeah.
Hi, I'm Kristen Jantris from Nonprofit Finance Fund. And I just offer to folks in the room, we've had the real honor and privilege of sitting at the center of a lot of the true cost work in California and working with Philanthropy California and being in rooms where we are able to facilitate those kinds of conversations between nonprofits, funders in philanthropy and in government, very much on these issues around value and cost and what we're all trying to really achieve. And so there's no easy answer to it, but we'd be certainly open to having that conversation with anybody here and connecting you with those who are doing work in other places as well.
Thank you. Thanks.